I'm joined once again by Tucker Carlson, who's a senior fellow at the Cato Institute and a Fox News contributor, and Bernard Whitman is a former pollster for President Clinton. All right, let's go to the former pollster. How do you like those poll numbers?
Well, what the poll numbers left out is the fact that a majority of Americans, 54%, support the plan, and 54% favor President Obama to deal with health care over the Republicans. The Republicans have to come up with something else other than let's start from square one or just say no. If this
they don't want to start from square one. They want to try to fix the things that are wrong with the plan. For instance, have some insurance reform. They don't want people to end up losing the plan that they have. And I think a lot of people frankly don't believe the president when he says that if they like their plan, they can keep it.
Well, it's the lies and the smears that have been put forward by the Republicans that are causing a drop in the approval rating for the president. The president remains extraordinarily personally popular. He has got a very tall order and a big lift on Wednesday. I think he's going to get the job done. But what he has to do is connect health care reform to economic reform overall. That's what he did in the State of Union, is sort of connect all these different issues together. And I think that if he can convince the American people that this is the best chance we have in a generation,
I don't think they're convinced of that. And I think that's a very crucial point. I want to bring Tucker in on this. Tucker, from the very beginning, President Obama has tried to sell this package as, the reason that we're in such economic dire straits is the rising cost of health care. And even today he came out once again and said nobody disputes that. I think some people do dispute that as a central tenet of what's wrong with the economy.
Well, the real estate bubble burst.
Exactly.
That's what got us immediately into the recession. Sure. I mean, that's a pretty big conceptual stretch. The president's a charming man. Maybe he can sell that connection, but it doesn't solve the problem. The problem is on Capitol Hill. The problem is that the president, a Democrat, Democrats who run the Congress have overreached on this, and some conservative Democrats recognize that and are afraid of it. The things that we know about, by the way, the idea that the average American supports a bill that nobody in America fully understands doesn't mean very much. But here's what we do know. We do know it expands Medicare, the most failed of all federal programs. We know that it's going to cost way more than the administration initially represented its cost as being. And we also know that it's going to require, in fact, higher taxes. And there's no assurance at all that it's going to stimulate the economy in any way. I mean, the stimulus package hasn't stimulated the economy. So I think people are wary. I think the Republicans, by the way, don't need to present an alternative. They got a lot in 1994 and 95 out of just opposing Hillary care. I mean, in the short term, that really helped them. I think the position that they are taking now, which is slow down, let's talk it through, I think that's potentially a winning
so maybe
position.
By doing nothing, they're in a better position, because people look at, Canada, they look at Great Britain, they say, you know what? I know there are flaws, but I'm better off with what I've got.
Do you know what the Republicans gave us by stalling health care reform in the 90s? Extraordinary rises in health care costs and tens of millions of Americans without health insurance. We have got to fix this problem. I think we are going to get a deal done. Whether that happens in August or by the end of the year is not so clear. But
you think you're okay with, like, for your personal health insurance, if they say, well, your company says we don't like, giving you this program anymore, we want you to go on the public plan, you'd be okay with that?
But that's not going to happen.
Would you be okay with that?
I would not be okay because I've got a decent plan. We cover our workers very well.
You know what?
And under Obama's plan, we will be able to keep the exact health care plan that we have currently, and that's what the American people need to understand.
Do people believe that, Tucker?
No, I mean, of course not. Look, you need something of great value transported across the country. Do you choose the post office or Federal Express? I mean, you know what I mean? I'm not saying the government isn't good at anything. It is. But with concepts and practices that are nuanced, very complicated, like health care, government is not always the right answer. And I think anybody who goes to the DMV understands that. I'm not saying government has no role in regulating health care. I'm merely saying that a plan cobbled together in 4 months, the idea it's going to solve everything, is a lie, and most people don't believe it.
All right, I've already been wrapped. So, Bernard, real quick, if you can.
The one thing I'll say is that in this case, I think Americans should absolutely listen to their doctor. The AMA endorsed the House plan, and I think that is the best prescription to fix America's health care system.
All right. As we said in the break, I've talked to a lot. Every doctor I say, what do you think? What do you think? And I haven't found one who thinks that it is a good thing for healthcare in this country, but you're talking to different doctors, so that's what makes the world go round. Bernard, thank you very much. Bernard Whitman, Tucker Carlson, always a pleasure to have you with us. Thanks, Tucker. Martha.